Now, how is this for a COVID recovery plan to help both the retail sector and the NHS? A Dorset department store is giving over an entire floor to be used as a hospital outreach facility. The partnership will enable medical staff to start reducing waiting lists. It's also a shot in the arm for the shop, which has been through its own rough few months. As our health correspondent Alastair Fee reports, the idea is being watched with interest across the country.
Like so many patients this last year, Charles knows what it's like to wait.
It's been cancelled a few times. It's been cancelled twice, so it's a system we paid in for all our lives, and yeah, it should be there on demand and a good and quick service.
He's in Bournemouth for a routine check-up, but for others, appointments can be life-changing.
We have a huge patient backlog of about 2,800 patients that we need to see. The challenges are the reduced capacity in the clinic, the need to see patients in a timely fashion to prevent sight loss.
This eye unit, like so many departments, is struggling. COVID-19 and social distancing continues to cause major disruption to patient care. In the Dolphin Centre in Poole, I was shown a potentially groundbreaking solution in Beales department store.
So as we come in here, if you just come from ophthalmology, over here we've got our general areas for consultant rooms.
Best known for being part of the military team behind London's Nightingale Hospital, Ashley has set up field hospitals all over the world.
We've taken those ideas from the Nightingale systems, the ideas from the vaccination centres, and then looked how we could repurpose this space to do a different kind of delivery programme for outpatients.
Department stores, Beales included, have never seen a more difficult retail environment. They simply don't need the space they're used to.
It will inevitably increase the footfall into the store, and it being on the top floor is very advantageous to us. But it's about using the space more wisely. It's about recreating retail on the high street, because there is too much space out there in some of these big shops, and there's a better use for it than just either filling it full of stock for the sake of filling it full of stock, but getting involved with the social enterprises in each town to make the space work better for everybody. It's a community thing, not just a commercial thing.
The top floor will in future be where patients go for dermatology, orthopaedics, ophthalmology and breast screening. Not a walk-in, but all by appointment.
The clinics here will be face-to-face with trained NHS staff. It's here where treatment options at hospital will be decided, but no major procedures will take place here.
It sounds a fantastic idea. Hospitals under pressure, especially after the last 2 years with the COVID.
In principle, we think it's a great idea, but in reality, it needs to be thought through in terms of transport and accessibility.
This permanent new clinic will be run by up to 30 NHS staff daily. It'll cost nearly £6 million over the next 3 years.
The key thing is about getting to those outpatient numbers, to reach out to those patients, to assess them, to get them onto a journey and get them to a destination that they need to get to. That's what we're about. That's what's driving every single clinician, every single support person, every member of the team here. That's what's driving us to make a difference.
The builders will come in next month, the first patients later in the autumn. Alastair Fee, BBC South Today.